we took a decision that let it be anything, whether we are making it physical or we are making it digital, or you can say hybrid, or we are going to make it digital, but we are going to celebrate it. We don't want that we should miss the 2021 and go into the 78th year. At the outset, I welcome you to this pre-platinum Jubilee CME. And over the last almost 2 months, in fact, my department started this on 1st July. That is the auspicious National Doctors' Day, marking the birth of the legendary physician, Dr. B.C. Rai. Now, we have almost about to cross the first page. Now we are plunging into the second page from 13th of September. The second page of our celebration will be academic part, but mostly it will be cultural and entertainment program. Again, each department or each stakeholders have been given allotted a day for 75 days, depicting the glorious 75 years SCB has passed through to achieve what status it has now. I must also communicate at this juncture that on the Platinum Jubilee celebration year, our Honorable Chief Minister yesterday inaugurated a launch and dedicated the largest ECMO unit in India in a government hospital with 9 ECMO facility, which was launched yesterday. We are starting our ECMO procedure from today. Now, the third phase, the second page is 75 for 75 that start from 13th of September. The third page is the main program, main function will be on 26th, 27th and 28th November. I extend a warm welcome and invite all of you to please join us. Whatever form we are doing, whether it is physical, whether it is hybrid or it is digital, all our program will be live streamed. We will provide you the link. So please make time to join us and encourage. Now, all the speakers in the past invited by different departments will be definitely felicitated on the day allotted to the department in our meeting in 75 for 75. If you can come in physically, we'll be really obliged. We'll feel very happy that we are having you back again after the CME program. But if at all there is some indisposition, then we will definitely send our regards and felicitations through post. With these few words, I again welcome you to this program. And I always mention that possibly you would have missed all these things had you not organized this pre-platinum Jubilee CME. The amount of information and knowledge that everyone is gaining through the CME, it cannot be expressed in words. Not only the knowledge, the fellowship as well. A lot of the alumni whom we had not known, they have joined and they have reunited back to their alma mater. I extend my warm welcome and hand over to Professor Singh for conducting the further proceedings.
Thank you, sir. It's been a great time we have had starting from your department's program and now coming to the end of this pre-platinum Jubilee celebration, which will be followed by 75 for 75, 75 days of celebration before the final, that countdown, that is the finale. We'll have a 2.5 day program of the Platinum Jubilee in November end. For today's program, we have two very brilliant speakers. We deliberately chose the topics so that it will be of interest to all. Sometimes the topics, are some other department people find boring. They're not very interested. But I thought we chose these two topics. One was intermittent fasting and the other was exercise. I thought this was, everyone is interested to know about these two things, right? So for this, we have the two faculty we have today are Professor Gauradas Chaudhary. Professor Gauradas Chaudhary is a very eminent gastroenterologist of this country. He's got numerous awards. He's also a B.C. Roy awardee, and in addition, he's got a large number of awards. I can't, give a count of them. He was the president of the Indian Society of Gastroenterology, and before that, for 6 years, He was Secretary General of Indian Society of Gastroenterology. Most of his life, he worked in SDPGI Lucknow, where he headed the Department of Gastroenterology. And then subsequently, after leaving SDPGI, he is now settled down in Delhi. He is working in the Fortis Memorial Research Institute in Gurgaon. He's done work on, he's got hundreds of publications, and he's done work on various aspects, not just limited to hepatology, NAFL, he's worked on pancreas and so many. But besides that, he's done a lot of work. He's got an NGO, and through his NGO, he's done a lot of work in creating awareness about various diseases in different parts of the country, especially in school children. So he speaks so well on this subject of intermittent fasting that we decided that I think this is the topic everyone would love to hear. And the second speaker we have, as per our protocol, we must have an alumni to speak on, is Dr. Preetam Nath, who is Associate Professor of Gastroenterology at KIMS Hospital, Bhubaneswar. Preetam did his MBBS from here and his DM from here, from our department. And he's very bright. He's got a long future ahead. He's been a faculty in different international and national meetings on NAFL especially. And in fact, his dissertation was on NAFL and exercise, effect of exercise, the intensity of exercise on NAFL. So I thought he would be the best man to speak on this. So without much ado, I think we should straight move to the two lectures, and after that we'll have a discussion at the end. May I now request Professor Gauradas Chaudhary to speak on intermittent fasting. Professor Chaudhary, please.
Thank you very much, Professor Singh, and respected Dean Sir, and all my friends and colleagues in Cuttack and Bhubaneswar. At the outset, let me wish all of you a very, very warm greeting on this very festive and joyous occasion of your medical college. It always makes one feel very proud to celebrate so many years of wonderful legacy and reputation. And, you know, it has produced such fantastic people. I mean, I've had the pleasure of working with many of them. The topic assigned to me is, can I share the screen? I'll just start the screen sharing.
Yeah, please.
Yeah. Is intermittent fasting. And I'll tell you, there is a lot of thought behind this choice of topic, which Dr. Singh has chosen. You know, regardless of the specialty that all of you belong to, the statistics are very clear. In urban India, the commonest cause of death today is actually metabolic disorders. So it's cardiovascular disease, diabetes, complications, stroke, and so on and so forth. So gone are the days when it used to be only snake bites and, you know, infections and so on and so forth. Nowadays, 65% of deaths in urban India is actually metabolic or has its roots in metabolic diseases. So the world is actually looking at how exactly to manage that. Otherwise, you know, I mean, it's very fashionable to go to a hospital, get a stent put, keep taking aspirin, and then till something else happens in the brain. So that's the way things are. So we have tried many things. When I say we, it means the medical community and the biomedical scientists. So they have tried statins, they have tried so many things, but the crux of the problem is it's behavior related. So we are at the moment consuming more calories than we are burning. And you can actually give a pill to a patient to pop in, but it's very difficult to change behavior. But with that background, let me just start off by telling you a bit about intermittent fasting, which has become a very, very important topic now. We all know that in order to remain fit, the two key pillars are diet and exercise. And I don't want to put any of you to any embarrassment, but if I were to ask the faculty of your prestigious medical college that how many of you do regular exercise, it might be a little disturbing, because I'm sure many of you don't. And to be honest, even I don't, because I'm a fairly lazy fellow from across the border of where you stay. So laziness, biological, our social behavior, all these things do make us prone to diabetes, hypertension, obesity, fatty liver disease, cardiovascular disease, and stroke. That's a fact. So one of the new strategies which has actually come in is something called intermittent fasting. It is not one of those usual diet fads. So, as soon as you hear about a dietary regime, you always think about diet fads. And in case if you're interested in Googling and Google which are the weight reducing diets, you will find 90 of them, out of which 29 are very popular. For example, you would actually have something called a Keto Diet and a GM3 diet and so on and so forth. This dietary regime is actually not one of them, because in those dietary regimes, they keep talking about changing the food type or quantity. So Atkins, Keto, Weight Watchers diet, what do you call it? There is another one called Slim Bitch diet. So very funny names also. This particular diet is actually a time restricted diet. So it allows you to do what you want.
Manas asked Manas to send a mail he was supposed to send to both you and so, but we
Can you mute Dr. Singh for a while, please? Yeah. He's on the phone. No problem. So this is actually a different type of a diet called a time restricted diet. So it allows you to eat what you want. So if you're eating rice and potatoes and fish as you would be doing, as we do, or if somebody is eating tandoori roti and paratha, he can actually do that. But there is a time element to it. It's not what type of food, but the timing. And let me tell you why it happened. It started with an experiment done long time back in the United States, in which a scientist kept peanuts for a rodent for just 1 hour every day, and then he removed the peanuts. On the other hand, he kept a similar breed of rodents in a cage and gave it a lot of peanuts so that the rodent can eat it all through the day, whenever he wants. And after a year, he realized that the ones who had ad libitum peanuts, they became fat and they died because of cardiovascular problems or metabolic problems. The ones who were getting peanuts only for a restricted period of time, and the rest of the time they were hungry, scurrying around, climbing trees, they were lean, but they lived longer. Now, this particular study was done almost about 30 years ago, maybe more. But after that, somehow it didn't catch the attention because there wasn't much of marketing involved with this. For most diets, there is a very active marketing. So there is an Atkins, a Keto, and a Mediterranean and whatnot. This doesn't actually have a marketing base at all. But this was very interesting. And that's why it was picked up by quite a few other scientists that, if it is so, how does it work? So let me first tell you what is intermittent fasting. Intermittent fasting means that you deprive the body of carbohydrates or glucose for its metabolism for periods of time. So, for the brain and for the muscles and for the heart, we usually require glucose as an energy source. And that's the reason why we have 3 meals a day. And in all 3 meals, we often take carbohydrates. So bread and rice and wheat and whatever. So the body gets used to carbohydrates and glucose as a source of energy. Now, what happens if suppose you have longish periods of time when you do not give carbohydrates? So what happens then is that the body switches. So there is something called a metabolic switch, in which it switches from using glucose as an energy source to using fatty acids as an energy source. Okay, so that is the crux of the issue. And there are many types of intermittent fasting. You might have heard about it. The commonest, easy to practice one is called 16-8, which means that you fast for 16 hours and eat during an 8-hour window. So you can have your breakfast and lunch, skip your dinner, or you have a late lunch and a dinner, but skip your breakfast. But 16 hours of fasting. Or you have one called 5-2, which means that 5 days a week you eat your normal food, 2 days a week you eat a very calorie restricted food of 500 kilocalories a day. And there is another one called the alternate day fasting. So it depends on the name. So I'll just tell you that is what intermittent fasting is all about. This is the 16-8 method. So you have an 8-hour window. Remember that our 24 hours, it has got 3 8s in it. So one of the 8 windows you can eat, and the other 2 you don't. So normally during sleep, we are anyway fasting. It's a 12-hour fast, and that's why it is called a breakfast. So we break our fast in the morning. But if you extend that fast to 16 hours, it starts showing results of a different type. The other method is actually called an alternate day fasting, where 3 days a week you have 500 kilocalories a day. The other 4 days you eat normally. Actually, to be honest, many of us, we have had grandparents, and many of them used to keep 1 or 2 days of fast in a week due to religious reasons. So Ekadashi, for example, or Monday fasts or Thursday fasts and whatever. So these are the prolonged periods of fasting which are practiced in intermittent fasting. And the other one is a 5-2 diet. So 2 days a week, you can choose your 2 days, and the rest of the 5 days you eat normally. So that's the method. I've told you the basic idea and the method. So the basic idea is not calorie restriction. Unlike all other weight reducing diets where you're restricting calories, here you're not restricting calories. You're only switching the energy source from glucose burning to adipose tissue based ketone burning for fuel. And that only happens during fasting. This too came to me as a lesson because, I have been a proponent in schools, and I have been going around giving talks for the last 25 years that you must have your breakfast because the brain requires glucose for metabolism. Otherwise, you won't be able to learn maths and you will keep forgetting your lessons. But then, when I read this article in NEJM, I realized that actually you don't really require glucose. That was the concept which we had when we were taught. And actually, fatty acids can be as good a source of energy even for the brain, which to me came as a surprise. Now, people who have been doing this intermittent fasting, they report a lot of benefits. And here is a list. So the liver fat, I think let me start with the favorite topic of Dr. Singh, fatty liver disease, which is so common today. The fat tends to go away from the liver. Insulin sensitivity improves. So the liver size actually comes down if it is enlarged. Your intestines actually, there are ketone bodies production improves. Skeletal muscles, actually insulin sensitivity increases. Now here there is a trick. If you don't eat enough, you can have sarcopenia or muscle atrophy. But if you do intermittent fasting and if you keep doing a bit of your exercise to build your muscles, see, the muscles actually are a very important source of burning fat and glucose. So that's why you get a double whammy. Brain, your hunger response improves. And this is very typical. So every time I go to Cuttack and SP Singh feeds me wonderful sweets, I feel like eating more and more. The peras from Puri, for example, or Bhubaneswar. And this happens. The more calories you consume, the more you get addicted to it. So that actually comes down. Stress resistance improves. Inflammation and oxidative stress comes down. These have all been proven in scientific studies. On the cardiovascular side, the resting heart rate and blood pressure comes down. Your triglycerides and cholesterol comes down, and there seems to be a tremendous improvement in cardiovascular risk factors or the profile, so that you start getting better. Now, these have been proven, and there is one more thing which has been proven. carcinogenesis. The carcinogenesis occurs because of a particular, there's a cumulative accumulation of a chemical which is due to the burning out of degenerating or senile cells. So that actually tends to come down, because when there is less glucose, only the healthy cells survive and the degenerating, declining cells actually go away. So much of the tissues have actually good healthy cells, and they have shown decreased carcinogenesis. So that's the list of benefits which one can get. So in short, intermittent fasting has shown to improve type 2 diabetes, hypertension, so the blood pressure comes down, weight usually reduces, lipid profile improves, the fatty liver part improves remarkably well. I'll show you that. It tends to reduce the aging process. Now, aging process is actually a pretty complex process. So at some time we'll discuss that. It reduces carcinogenesis. I told you the cumulative carcinogen accumulation comes down and life expectancy goes up. Now, many of them you might challenge, so I'll just explain that to you during question answers. This is changes in body weight and body composition at week 4 and week 12. You see, the body weight comes down once a person starts doing intermittent fasting, and the orange bars show the best improvement. ADF means alternate day fasting. Okay, so you have the biggest dips in those bars, and the same applies to the fat mass. So if you want to actually reduce your visceral fat mass, this seems to be a very good method, along with the rest of the benefits that occur. Okay. This just to tell you that this is social media. This article in the New England Journal of Medicine. This was published, to be precise, on the 25th of December 2019. This before the lockdown started. We were in Calcutta time for the conference which Dr. Mahesh Goenka had organized. And effects of intermittent fasting on health, aging, and disease. Fantastic article. And it actually lists all the different studies that have been done using this method on the benefits tissue-wise as well as long-term outcome-wise, which I thought was a very good read for especially people like Pritam would actually probably like to do that. A little bit of personal note that, is it just theory or practice? So this lady is a relative of mine. So this is the picture I saw, I took when I was in New York. This was in 2019 in the month of May or June. And she was a little chubby lady. She, by the way, was a dean of a engineering college, and she's quite a bright scientist. And that's my granddaughter. And, I went for another conference about 5 months later, and this is how she looked at that time. So she had lost 7 kilos of weight. She was walking 10 kilometers from South Manhattan to Central Park. She was so full of energy that my daughter couldn't keep pace with her mother-in-law. Often it's the other way around. And she was fine. Her lipid profile had improved. Her blood pressure medicine requirements had gone away. And she was in the pink of health. So this is a genuine case of that I came to know. So I started following it. And after one of my talks, I was impressed. Dr. Mahesh Goenka, the eminent gastroenterologist from Calcutta, he got up to say that he had been practicing it for 8 months and he had lost, I think, around 8 kilos, and he was never feeling as fit as he was at that point in time. So it's a little difficult to do, but people who have started doing it, many of them do see the benefits of it. What are the hurdles? I mean, everything has to have a side effect or a problem. See, the problem is that we are brought up on this culture of 3 meals a day. And therefore, skipping a meal is something which has, the Western thought process has made us convinced that you should never skip a meal. But when you go 2 generations back and you look at your grandmother or grandfather keeping the fasts, we used to think they were outdated, but actually they lived pretty long. Their incidence of diabetes was much less. and many of them died of old age rather than cardiovascular disease. Okay. And well, that's the way it is. Diabetes was not as common then. So when people tell that India is becoming the diabetic capital of the world, look, our gene pool is the same. So you can blame genes, but there is something else which has happened. Otherwise, the great-grandfathers and grandmothers would also have had diabetes. There must be an environmental factor and an eating pattern which has actually unmasked a genetic predisposition. So meal modifications may be diabetic. So the other hurdles are, of course, for diabetics who are on insulin. They have to be very careful. Controlling hunger is often a problem, And again, the brain starts tickling you whenever the meal time comes. You know how it is. Pavlov's dogs used to salivate, and human beings also salivate. But if I draw the example with that, okay. So we are a bit used to it. But after 7 days, the hunger part actually comes down. And this is a beautiful picture from the United States. This is how David looked. This is the statue of David by the great sculptor called.
You have become mute. Professor Chaudhary, you are not heard. You have become, yeah.
Is it okay? So this is the actual picture of David that Michelangelo created. This was during the Renaissance period. And this is a mockery of the modern David, which is called an American David. So in America, fatness has come to be partly associated with Americanization because of the high amount of calorie intake, burgers, pizzas, chips, and what have you, and much less of exercise. And that's the reason why the Western world is seeing a lot of cardiovascular problems, and we are following very promptly on their footsteps. So that is all that I had to tell you. There is only one more point I will add. Interestingly, I have a lot of Muslim patients, because I practice in Lucknow. And I see a whole lot of them, they're quite plump. They eat a lot of mutton. The lipids are high. But usually, when they have that 1 month fasting, Ramzan, they lose 3 to 4 kilos. And comparatively, I think that, their incidence of heart disease and stroke is not that high as one would have expected, almost a similar story to Italians who binge on pizzas and yet they seem to live pretty long. And now the world has recognized a type of diet called a Ramadan diet or a Ramzan diet, which basically is an intermittent fasting because they have their morning sehri at about 3:34 and their evening iftar at about 7 o'clock. So it's a very prolonged phase of fasting. Maybe that gives a lot of advantage to them. There are a lot of studies going on. And so far as other religions are concerned, Christians follow one called Lent, that is, a period of fasting before Easter. Hindus usually follow something called Navratri and quite a few others. And they have a whole lot of reasons for fasting, Ekadashi and this and that. But, we seem to have discarded it. And now intermittent fasting seems to be coming back. Last point that I want to make is that people are still confused. So they're trying to learn why some people live longer. So there are 5 parts in the world. They are called blue zones. It's a very interesting topic for any of you to search. So 5 parts starts on the east with the Japanese island called Okinawa. And to the west, it goes to California. There is a Seventh-day Adventist small group there. They usually have the highest number of centenarians, that is people living to be 100. And the interesting thing about all blue zones is that actually they all have some kind of ritualistic fasting, which is a part of their lives. And that's why there has been a renewed interest in fasting as a method to remain fit. So that's all that I have to say. Thank you so very much for your patient hearing. And I would encourage many of you to ask questions and explore this. Thank you, sir.
I think.
True.
Hello. Thank you, Professor Chaudhary, for an excellent and very thought-provoking and stimulating talk. So we'll take questions after this session, after Pritam finishes his talk. So
Sure.
now I'll invite Dr. Pritam Nath, who is an associate professor of gastroenterology at KIMS Hospital, Bhubaneswar, and he will be talking on exercise and liver health. Dr. Pritam, please start your talk.
Good afternoon, sir. Am I audible, sir?
Yes, please. Continue.
Okay, and my slides are also visible.
Yes, it's visible.
Okay. So, respected chairperson, sir, esteemed faculties and members of the SCB Alumni Association. So, at the outset, I would like to thank my mentor, Professor S.P. Singh, sir, for providing an opportunity to talk on this subject, and it is always a pleasure and a privilege and great opportunity to speak in the alumni member a talk in the alumni member association, which is my alma mater. So today I'll be talking on exercise and the liver therapeutic implications. So I'll be discussing briefly on the introduction and its effect on the major liver diseases which are prevalent across the globe. So beginning with the skeletal muscle, it is recently, it is not only an organ which helps in doing the movements and locomotion. It is one of the largest, it is even more, carries more weight than the largest organs of the body. It is considered as an important endocrine organ. So it secretes various kinds of cytokines and other peptides, which are popularly known as myokines, and which affect all the major organs of the human body. It may be heart, liver, or adipocytes. And most of its beneficial effects of the exercise are achieved by activation of the AMP kinase. Whenever somebody performs exercise, it leads to depletion of the ATP, and which activates the AMP kinase, which and this AMP kinase activation modulates all the beneficial effects of the physical activity or exercise. So if we summarize all the effects of exercise on the human body, so whenever one follows a sedentary lifestyle, the myokines or cytokines secreted by the skeletal muscle usually follows a pro-inflammatory shift, and it leads to impaired glucose uptake and increase in the insulin resistance, which leads to increased development of all the chronic diseases like obesity, diabetes mellitus, hypertension, coronary artery disease, and also some solid malignancies like carcinoma breast or carcinoma colon. But whenever a person does increased physical activity or more exercises, there will be an anti-inflammatory phenotype in the myokines secreted by the skeletal muscles. So it leads to improved glucose uptake and insulin sensitivity, which further helps in decreasing the incidence of all the chronic diseases as discussed earlier. So now beginning with the discussion of the effect of exercise on all the major chronic liver diseases. So let us begin with non-alcoholic fatty liver disease. So it is now the most common chronic liver disease across the globe. It may be developed nations or developing nations like our country, India. It has been seen that from all the major systematic reviews published on the incidence and prevalence of the non-alcoholic fatty liver disease, that overall 20 to 30%, that is 25% of the people, even in India, are suffering from non-alcoholic fatty liver disease. In India, if we translate this figure, it will be around 30 to 35 crores of people. And in next decades, it is projected to be the most common indication for the liver transplantation, surpassing the hepatitis C in Western countries and also in the alcoholic liver diseases and hepatitis B and other chronic liver diseases in India. So it is a wide spectrum, starting with the benign steatosis to non-alcoholic steatohepatitis with fibrosis and non-alcoholic steatohepatitis related cirrhosis, and finally hepatocellular carcinoma. So it has been seen that 10% of the patients with non-alcoholic fatty liver disease, they develop cirrhosis and may develop hepatocellular carcinoma. So, and it has been seen that the incidence of non-alcoholic fatty liver disease is more in the obese patients. And if we do a subgroup comparison between obese and non-obese people, it has been seen that this incidence of NFLD is more who are more sedentary and who perform low intensity or low level of physical activity. And the incidence is quite lower when in people who perform regular high level of physical activities. So despite being a very more common liver disease, so we don't have a very good effective drugs. So the treatment of NFLD can be divided into non-pharmacological entities or pharmacological entities. So among the drugs, we don't have very good drugs at present. So there are only two drugs, vitamin E and pioglitazone, the pioglitazone, which are proven to be beneficial with uncertain efficacy, but they don't work in all patients, and long-term safety is questionable. Long-term safety data beyond 2 years is not available till now, and NFLD is a chronic condition. Treatment patients may require lifelong treatment. The other drugs which are used for treatment of other diseases like ursodeoxycholic acid, metformin, saroglitazar, they may be beneficial, but future studies are required. Recently, we have obeticholic acid, but we are yet to get an approval for this BCG or FDA approval for NFLD. But this drug is not very promising as it seems. So among the non-pharmacological treatment, which is the only mainstay and approved treatment for a non-alcoholic fatty liver disease, it comprises of dietary modification, mostly restriction, and physical activity. Most of this the non-pharmacological treatment acts by inducing weight loss, which in turn leads to improvement in the insulin sensitivity. So to achieve the desired weight loss, that is at least 5% of the body weight, we require at least 500 kilocalorie of calorie deficit between the total energy expenditure and total calorie intake. So total energy expenditure, which should be more than the calorie intake to achieve this weight loss. Total energy expenditure is the combination of resting energy expenditure, which the amount of energy which is required at the basal state, plus physical activity and thermogenic effect of the food. So physical activity helps in increasing the calorie deficit in addition to dietary modification and achieves the target. So in the studies conducted on the non-alcoholic steatohepatitis, it has been seen that people who achieve weight loss by this lifestyle modification, they have a higher, they have more reduction in the liver fat, hepatic necroinflammation. However, the effect on fibrosis is not as good. It is mostly comparable, and also it has the amount of weight loss has a dose response relationship or effect on the histological feature of non-alcoholic steatohepatitis. When a person achieves more than 5% of weight loss, there will be only improvement in the steatosis. But when the amount of weight loss is more than 10%, then there will be more improvement in the non-alcoholic steatohepatitis and also in improvement in the fibrosis. So physical activity on on non-alcoholic fatty liver disease, it helps in decreasing the liver fat. It improves the liver enzymes, and not only the liver enzymes, on biopsies, on repeated paired biopsies, it has also been seen to improve the histology. The impact of fibrosis has also been seen in biopsy studies and also in other non-invasive marker studies. So the effect of exercise, like on dietary modification, it is not limited to only weight reduction. It has also some effects which are independent of the weight loss. Even if a patient doesn't achieve the weight loss, there will be benefits in the liver. There will be reduction in the liver fat as it activates the liver X receptor. This AMP kinase, which I talked earlier, it will lead to increased PPAR, that is paroxysmal proliferator activator receptor alpha or gamma activation. That will lead to decreased liver necroinflammation and improvement in the histological and fibrosis of the non-alcoholic fatty liver disease. So how much exercise to perform? So all the guidelines usually say that for all chronic diseases, moderate intensity exercises should be done for at least 45 minutes per day. That should with a frequency of 5 days per week. So in non-alcoholic fatty liver disease, the INSL guidelines also speaks the same. We are about to get the clinical practice guidelines in a near future. So for NFLD, the recommended is aerobic exercise that should be of moderate intensity of minimum 45 minutes or 5 days a week. And by moderate intensity exercise, we mean a target heart rate of 60 to 70% of maximal heart rate should achieve. And the maximal heart rate can be calculated by 220 minus age. Next, which physical exercise is more beneficial for NFLD? It is a evolving question, whether it is a aerobic exercise or resistance exercise. Aerobic exercise cannot be performed by all people, especially patients who are suffering from coronary artery disease or cardiological disorders. So now we have enough evidences in form of RCTs and also systematic reviews. And it has been seen that both aerobic and resistance exercise, they have a comparable effect in reduction of the both visceral fat and intrahepatic lipids. But resistance exercise helps in increasing the lean muscle mass, that is increases the muscle mass, and it helps in the improving the insulin sensitivity more as compared to aerobic exercise. So if we compare the pathophysiology of the or mechanism action of aerobic and resistance exercise, aerobic exercise acts by activation of the lipolysis. It helps in upregulation of the PPAR, that is peroxisomal proliferator activator receptor pathway, and alteration in the adipocytokinins secreted from the adipose tissue. Whereas resistance exercise, it leads to hypertrophy of the muscle fibers, and it leads to increase in the lean muscle mass, increases the basal metabolic rate, and it activates the AMP kinase and GLUT4 and other enzymes, and secretes an anti-inflammatory phenotype of the myokines. So if we compare the effect of both aerobic and resistance exercise, though the effect on BMI may be minimal on resistance exercise, but the changes, there is a greater reduction in the liver enzymes and intrahepatic lipids as compared to aerobic exercise. Though the effect is not significant, still we require a large number of RCTs to prove this, which is better among the both. So as if we accumulate all the or summarize all the evidences we have till now, it is always better to combine both types of exercise, that is resistance exercise at a frequency of 3 times per week and aerobic exercise at a frequency of 5 days per week. And the resistance exercise is more important for our patients because it has been proven that in Asian Indians, we have a higher prevalence of insulin resistance as compared to the Western people with non-alcoholic fatty liver disease. Next, let's talk about intensity. Is intensity important? So recently we have a lot of research in this. So, and it has been seen that people who perform more intense exercise and over a more extensive period, they have a very lower odds of having non-alcoholic steatohepatitis or advanced fibrosis in non-alcoholic steatohepatitis. Sharing our experience from the study conducted on police trainees in Biju Patnaik State Police Academy and our gastro department in gastroenterology department in SC Medical College, we have seen that when we compared the trainees who did moderate intensity exercise and low intensity exercise, we saw that the regression of ultrasound fatty changes of liver was more in people who did moderate intensity exercise than low intensity exercise. So vigorous intensity exercise cannot be done by everybody because you need to be an athlete for that. So those who cannot perform vigorous exercise, especially people with chronic diseases, the moderate intensity exercise is better than the low intensity exercise. Secondly, the effect of exercise on NFLD is not limited to the weight dependent on the degree of weight loss. It also has a weight independent effect. Though in our study we saw that the weight reduction was not significant, but it did the job in regressing the liver enzymes, also disappearance of the fatty changes in the liver after 6 months of the moderate intensity aerobic exercise. Now let us see about the effect of exercise in other chronic liver diseases. In other chronic liver diseases, we talk about chronic hepatitis C, where lifestyle modification, that is dietary restriction and increased physical activity, have been shown to decrease the body weight, decreases the fat mass. It improves the insulin resistance, which is more common in patients with hepatitis C, and it also helps in decreasing the liver enzymes. But in these studies, how much proportion is contributed by the dietary restriction or how much proportion was contributed with the physical activity, it is still unclear. We need further studies. Next, let's talk about cirrhosis. So it is usually everybody thinks that patients with cirrhosis of liver should not perform more exercise. It has been seen that, especially talking about patients with cirrhosis who have a clinically significant portal hypertension, which is defined by a hepatic pressure gradient of more than or equal to 10. It has been demonstrated in studies that whenever a patient with early child B or child A cirrhosis with portal hypertension performs moderate intensity exercise, there is a transient significant elevation of the portal pressure and decrease in the hepatic blood flow. So there might be some theoretical risk of varicose hemorrhage, but the long-term studies have proven that even after 8 to 16 weeks of moderate intensity exercise, there is no risk of varicose bleeding or any form of clinical decompensation of cirrhosis of liver observed in these patients. And on long-term exercise, there has been seen that there is a 5 to 10% decline in the portal pressure after the exercise. And besides, it also helped in improving the aerobic capacity and quality of the life and achieve the functionality in both professional, personal, and social life in patients with cirrhosis of liver. So benefits of exercise in cirrhosis of liver are multifactorial. So whenever moderate intensity exercise are performed, it leads to improvement in the cardiac function. It increases the ejection fraction, stroke volume. It also improves the lung function. It increases the lung compliance, decreases the stiffness. It helps in increasing the also vessel peripheral vascular compliance, increase the endothelial vasodilation, and decrease in the catecholamines and angiotensin II, which leads to all the deleterious effect of cirrhosis. And in the peripheral adaptations, there is decrease in the body fat, increase in the insulin sensitivity. In the brain also, there is decrease in the depression and anxiety stress, which is more common in patients with cirrhosis of liver. It also improves the cerebral blood flow, increases the quality of life. In liver also, it helps in decreasing the liver fat, improves the insulin sensitivity, and osteopenia, which is most commonly, and sarcopenia, which is most commonly seen in patients with cirrhosis of liver. It also negates these things, or at least tries to preserve the bone mass and the muscle mass in patients with cirrhosis of liver. But before prescribing exercise to a patient with cirrhosis with clinical significant portal hypertension or in a decompensated cirrhosis, there must be a pre-exercise safety screen to assess the cirrhosis related screening, like the MELD score, if it is more than 20, or if there are high risk varices. Before advising exercise, these varices should be taken care of by banding. If there is hepatic encephalopathy, then also it should be taken care of because there will be increased risk of fall. And after correction, the exercise should be supervised rather than unsupervised. The ascites also should be controlled. If the patient is having thrombocytopenia or anemia, then the prescribing, we should prescribe specific type of exercises which will lead to less risk of fall. And diabetes mellitus should be controlled. And if the patient is on diuretic therapy, the dose should be minimized because it leads to more muscle pain and hampers in doing the exercise. Secondly, cardiopulmonary safety concerns. It is not necessary for all patients, especially patients who will have signs and symptoms like angina or anginal equivalent or past or current history of coronary artery disease. They must undergo a cardiological checkup before advising exercise. And secondly, physiological competence, like if the patient is having tachycardia, bradycardia, hypotension or hypertension, or specific musculoskeletal disorders or history of fall, they should be taken care of before advising exercise. So after this, there should be a baseline performance assessment by most commonly 6-minute walk test. And we should assess all the barriers which are preventing the patient to doing exercise. It also holds good for patients with non-alcoholic fatty liver disease or other diseases. If the patient is having some musculoskeletal diseases or something, they should be taken care of. Then The exercise prescription should be customized as per the patient, including his disabilities and other comorbidities. And it should be prescribed usually by a exercise certified personnel or an physiotherapist who is trained in this. But unfortunately, we don't have such kind of staff in our country. But they should be little bit told about there should be a brief warm-up phase, and then an exercise phase of 20 to 60 minutes, which may include aerobic or resistance exercise, and it should end with a cool down phase, which involves the balancing or stretching exercises. And no exercise should be advised without adequate nutritional instructions. The people should take with cirrhosis should take adequate diet, that regular carbohydrate before and after exercise, and adequate protein intake, that is more than 1.2 gram per kg. Next, let's talk about hepatocellular carcinoma. So usually it has been seen that in older studies that exercise stimulates the AMP kinase activity and decreases the mTOR pathway. This leads to may lead to decline in the risk of hepatocellular carcinoma with people who do increased degree of physical activity. And it has been seen that people who do moderate to vigorous intensity of exercise, they are associated with reduced risk of mortality after the diagnosis of HCC. But for further benefits, we don't have adequate studies. We need, and whether it prevents the hepatocellular carcinoma or not, we need further studies. The effect of benefit of exercise doesn't end with up to cirrhosis. The benefit is also there after transplantation. People after transplantation, it has been seen that after liver transplantation, there is impairment of the aerobic capacity, and the people, they usually get tired or fatigue. They feel fatigue after small activities, and that may be due to increased hospital stay, increased 1 month of ICU stay, and due to the drugs, mostly steroids, which leads to myopathy. So exercise in this subgroup of patient, it helps in restoring the normal physical function. It improves the lean muscle mass, muscle strength, and improves the aerobic capacity, and it improves the quality of life in patients of who have undergone liver transplantation. So to summarize, exercise is beneficial for all kinds of liver diseases. It is at present only approved treatment along with dietary modification for non-alcoholic fatty liver disease. The beneficial effects on non-alcoholic fatty liver diseases are both weight dependent and also weight loss independent. It is also beneficial for cirrhosis of liver. It should be prescribed for all the patients with cirrhosis of liver after an adequate pre-exercise safety screen, and it decreases the risk of hepatocellular carcinoma. Thank you.
Yeah, thank you, Dr. Pritham and Dr. Chaudhary. Before we go to the questions, I have few little bit of inquisitiveness to know from Dr. Chaudhary. Dr.
Yes.
Chaudhary, yeah.
Yes.
You have mentioned about the 3 types of fasting.
Right.
The 16-8, 5-2, and the alternate day. Now, which one you would prefer if you yourself would like to undergo a fasting?
If I'm actually working as I'm still working, I prefer the 16-8. I did it for quite some time. During the lockdown, I tell you, lockdown was very educative. Some people improved their health, and quite a few others only watched Netflix and ordered food from the outside, and they became fat. So in 3 months, I was able to really get myself into good shape with a 16-8. Alternate day and 5-2 is a little more intense. And you know, unless, I mean, if suppose now I'm doing alternate day and I have to come and see patients, I often would feel that I'm a little irritable that day, you know, which is not fair to my patients, for example. So for me, the easiest is 16-8. But if somebody else can do more, and especially whose need is more, like somebody is quite overweight or obese, has got a bad type 2 diabetes, hypertension, very strong family risk of coronary vascular disease, I would say at least for about 2 or 3 months, he can start with a more intense one, 5-2.
And second thing is, if somebody picks up 5-2, because you know, for health, both diet and exercise, both are mandatory and requirements. Now, if somebody opts for a 5-2, should he do an exercise on the day of fasting, or he should avoid?
That I don't have a very clear answer, but I'll tell you what, the effect is best if you continue to do your exercise. Now, whether on those 2 days you might like to reduce your intensity of exercise, I'm not sure, because sometimes I'll tell you the sugars may tend to fall, the BP may tend to fall, especially during the summer months, if our salt consumption is a little low. So those are the things that have to be looked at, because at no point there should be anything unsafe that is happening. But the provision that they make is that water intake is as much as you want, and the calorie restriction is only up to 500 kilocalories per day. So it is not, again, 0 calories. I mean, it's not, I would say, complete fasting like Baba Anna Hazare type, So where you're on a complete fast, it is not that, but that's the way it is. So I guess if I had to do it, and if I were coming to hospital, I would take the major part of my calories in the morning, so that, I keep my balance and my blood pressure going through the day.
And the third and final, these are all informative. So nicely, we are really enjoying the talk. Third one, that you say that there should be more of a carbohydrate deprivation,
Right.
and the calories should be supplemented with either fatty diet or a protein diet. Either out of this, what would be preferable, fatty or a protein diet?
No, so I'll tell you, sir. In intermittent fasting, that is not the purpose. If I said that, I misunderstood. See,
No, I'm talking about. I'm not asking that. I'm talking about 5-2.
No, I understand, but let me explain this to you. Actually, when you fast, you are actually fasting for everything. Carbohydrate, fat, everything actually. It's only calorie measurement. One type of diet where they reduce carbohydrate and they give you more of fats and protein is the keto diet, which is actually very good for losing weight. I have a patient who never lost weight with my advice, but on a keto diet, he has lost 8 kgs. But keto diet is not good for the heart. So the American Heart Association has actually, sounded a little concerned, because it's a lot of animal protein, for example, a lot of fat. So although you're losing weight, your metabolic rate goes up, but it's not necessarily very safe for cardiovascular disease. In intermittent fasting, I do not think one needs to increase or change the proportion of meals at all. It is just that, your calorie needs to be restricted on that time, whatever you are taking. So that's the way it is. The fat that is burnt is from the endogenous fat in the body. So the ones which is there in my abdomen or in my hips or, around the visceral organs of the body, that is the one which is actually burnt during the fasting period.
So nicely explained. Thank you so much, sir.
Thank you.
Now I think I hand over to the moderator. Chitta, you can go ahead.
Thank you, Professor Chaudhary. It was such an excellent lecture. I think whenever we hear you, any lecturer, everybody just glued to your lecture. It's such a fantastic teacher, as well as a very good researcher, very good medical educator. Everybody throughout the country knows that. I just wanted one thing interesting you told about this Ramadan fasting. So I was actually thinking of asking you, but you told everything about it. But one thing I was wondering, even after having a fast, during the religious fast, whenever they take a diet in the evening, they usually take very sumptuous diet, like biryanis and all other things. So I tend to think that after fasting, would it not give a sense of starvation, and would it not encourage a kind of binge eating? So binge eating is actually not very good. It may be disastrous.
Very good question. I'm very happy that you asked this question. See, remember, there's one other side effect of fasting, which I forgot, I did not mention. The gallbladder contraction does not occur during prolonged fasting. And that's why gallstone formation tends to go up for people who fast. And at least even in the Muslim population, if you see, the frequency of gallstones is quite high. Because, there's a very prolonged period when the gallbladder is not contracting. That is number one. The second point is that I've actually studied this. So there are different types of breaking the fast. So, the polished people a little to the west, they usually break their fast with a date, and most of their iftar is basically fruit juices, fruits, and light food, pita bread and stuff like that. It's basically a phenomena of India, Pakistan, Bangladesh, where we have very elaborate preparations of biryani and parathas and kebabs for iftar. I shouldn't be talking about that religion because somebody may misconstrue me. Ramadan is actually a period of semi-mourning. It's not actually an enjoyable period, according to what the history is. So very elaborate heavy diet is actually not the norm. It has been the practice in recent times in this part, that is South Asia, Southeast Asia. But when I talk to many of my Muslim patients in, say, Turkey or any of the other places, they actually have a very moderate kind of a iftar diet. Otherwise, you tend to overeat and that becomes a problem. And then, their sehri, which is the morning thing, that's at 3:30 in the morning. So you have a heavy dinner at about 8:39, and then you again have in the morning. It doesn't really make sense. So most of them don't take much, and then they go through the day, especially in summer months, they're prone to dehydration.
That is one thing. The next thing is people who are really inclined to have this.
Thank you, Dr. Goenka. And thank you for giving us the highlights of quick summary and how to.
Thank you, sir.
Actually, what I wanted to ask, that people who are inclined to have intermittent fasting, is it really will help them to have a self-control and self-discipline in their diet, in their exercise, in their lifestyle? Have you seen patients who are practicing this intermittent fasting, their lifestyle changes, they have greater self-control in choosing the diet and other things?
Absolutely. I think you hit the nail on the head. There is a saying that people who struggle and fast and work hard and suffer together, the bonding is much better and it helps to build resilience. So the whole word today, especially in the post-COVID era, the word is resilience. How much are you able to cope with? So most of us have become somewhat pampered by very, abundance of food whenever we want to eat, lazy lifestyle. So building resilience is actually a challenge. And in fact, one of the things that really happens in many militaries, they actually help you to build resilience by making you fast and go through difficult terrains so that your body gets adapted to it. Otherwise, a predictable lunch and a dinner can't make it. It can't really be conducive to challenging times. Making the body adapt to challenging times. Absolutely right.
Yeah. And another thing, what is the effect of this intermittent fasting on the immune system of the body? Body's immunity. Ultimately, it is immunity which is very important.
So paradoxically, one would think that depriving food means the immune system might get weakened. It's actually quite the opposite. What the studies have shown, in fact, Dr. Panda, you're a very educated person. I would really strongly recommend you to go through that article. I'll send you the link. They have actually done studies on the immune system to show that the immune cells are now bursting with more activity if they are deprived of too much of glucose. Because it's the same thing, the policemen in Orissa, for example, if they are fed all the time very good amounts of rice and pulao, they are not able to run after the dacoits very well, no? So the same thing happens everywhere. You have to be able to deprive them to some extent in a calibrated way to make them function better.
Okay, thank you, sir. Thank you.
Thank you, sir. Thank you.
And
such a pleasure.
Any more questions from any of the participants?
Pritam, I enjoyed your talk.
Thank you, sir.
Pritam, hello.
Sir.
You really gave a very nice talk. So about the exercise, advocating exercise for cirrhotic patients. Cirrhotic patients, when we see, we are really afraid they're very weak. They are in different stages of chronic liver disease. Then you really need a lot of things to consider before advising them for going for exercise to build up their muscle, or at least to prevent the sarcopenia and other things. So I personally think it would be quite risky if you tell somebody, say cirrhotic patients, who is going for to go for exercise, then it has to be a very structured one. Do you think, is there any prescription of such kind of exercise in literature so that you can actually?
6:30.
Hello.
So actually, sir, there is a just a recommendation from Dr. in a paper in by Dr. Punita Tandon. So they have done a good review by the North American institutes. So they have a very good exercise certified personnel, and they have given a structured approach how to screen for the safety, and what cirrhotic related to assess the cirrhotic related issues, cardiopulmonary issues, do a baseline performance assessment to assess the risk of fall, or when to go for a supervised exercise, not go for an unsupervised exercise. And finally, every exercise prescription should be customized as per the patient's his physical performance level, and depending on the comorbidities and all the depending on its performance level, it should be customized.
Yes, yes, because most of the cirrhotic patients, they complain of extreme weakness, and always they ask for, apart from diet, what else can give them little more of energy. So in that context, it becomes very, very important. So all the physicians are hepatologists. It's very nicely, I think, given by you. Next thing is there any study by advocating or doing such kind of structured exercise, you can really prolong I think you can delay their period for transplantations or other things, especially cirrhotic patients, compensated or decompensated, who are scheduled to, who are thinking of going for a transplantation. Can it little bit delay that transplant period, interval?
Actually, all the studies, sir, are short-term studies, are maximum up to 16 weeks or 24 weeks. There are no long-term studies, and long-term follow-ups are not available. But further studies are required.
Okay, thank you. Thank you very much. Any questions by anybody else?
I think can we, so much deliberation, so beautiful talk by both the speakers. I hope, can we think of winding up? If the speakers permit.
Yes.
Sure, sir.
I think Professor, thank you, Professor Gaur Chaudhary, for an
But before Chita, you say,
yeah.
Again, I extend our warm invitation, warm welcome to you to please join us for our final jubilation on 26, 27, and 28. In case you are not able to come, kindly join us through the digital platform. Thank you so much, sir. Thank you.
So thank you, Professor Gaur Chaudhary, for this excellent talk, and you have really taken out some time, spare some time for this beautiful talk, which actually all the participants who have witnessed today must have known how well you have given the message about intermittent fasting, because intermittent fasting is a burning talk today. And thank you very, very much for that. We know actually you for such a long time, and whenever you give, wherever you deliver a talk, we are actually very, very eager to listen to that. Wherever you are giving a talk, all the people in the hall, students, the researchers, the senior fellows, everybody is glued to your talk. This is a very well-known phenomenon throughout the India. You're such a nice, gastroenterologist, and such a nice teacher. Thank you very much for sparing this time to be with us. And if you can come to our celebration, Platinum Jubilee celebration, it would be really a great honor.
I'll try my best. So kind of you. Very kind of you. Thank you, sir.
And thank you, Pritam. You are one of our best outgoing students, and you're doing so well. And I wish all the best for your future. And I'm sure in future we are going to see a lot of research work and a lot of academic deliberations from you. And thank you for this nice talk today you have given to it. And at last but not the least, I would like to thank our esteemed Professor Dr. Dateshwar Hota, our Dean and Principal, who has really put in a Herculean task, to organize the Silver Jubilee celebrations. He has devised everything by himself, and he is executing everything almost like surgical precision, I would say. And we are really extremely fortunate to have him as our Dean and Principal. And we are going to have a great Platinum Jubilee celebration. And thank you for that. And thank you all the participants for listening to these great talks. And thank you, Professor Singh, and other my colleagues and friends for participating in this today's scientific deliberations. Thank you.
Thank you. Thank you very much.